Okay, now we're going to talk about scheduling. That seems easy enough. You go into our Hino system and you schedule the patient. Yeah, it's not that easy. Okay, so at activation, which you have learned in the activation video, we talk about how we as an organization schedule on medical urgency. We're a small family, we're a small team, so we cannot fit in a lot of appointments at once. In other words, we have a certain amount of slots to fill, and those slots need to be filled. And if there's a patient who is urgent, meaning they have a lot of pain or they are post-op, they just had a surgery, we need to be able to get them in that day. Yeah, you heard me right. We need to be able to get them same day. So if we have a packed schedule and we have a patient who is urgent, they need to get in that day, then we need to call up one of our patients we know, and we know we've already established a relationship with that person, and we know they're doing pretty good. So then we need to call that person and be like, hey Mary, I'm so glad you're doing great, and I know you have a schedule today. I wanted to ask you a huge favor. We have a patient who is in a lot of pain, they're urgent, they need to be seen today. Is there any way, Mary, that you would be able to give up your slot to this person? And in turn, we will give you a free red light therapy next time you come in. You may not even need to say that. Mary may be like, hey, no problem, you know, not a problem. So next time Mary comes in, you need to thank her a gazillion times. You may not have to give somebody a free elective service in order for them to be to give up their slot, because people are just good people. If Mary doesn't want to give that slot up, then you can call the next person. If you get really desperate, then you can give a free laser treatment to them or something. But whoever it is, when they do come in, you know, after they gave up their slot, just make sure you love them a bit that day for making that sacrifice. That's going to be rare, but if that type of thing happens, then that is a way to get that urgent patient on the schedule, because that is imperative. At the time of activation, you're going to find out if that person is in a little bit of pain, a medium amount of pain, or a lot of pain. That tells you if you need to get them in right away, and you communicate to them during activation. Hey, it sounds like you need to get in right away. It sounds like you need to get seen. So let me see what I can do for you. Let me put you on a brief hold, and I'm going to check out our schedule and see how I can make this happen for you. So then you work your magic. And if they're in medium pain, they can wait a few days. If they're not in any much pain at all, then they can wait a week or two. That's okay. And if that changes, if their pain changes, then you can just tell them, give us a call if your pain starts to get worse, and we'll get you in sooner. Now, your job as a scheduler too is to make sure those slots in that schedule are filled up. So you want to make sure the flow is going. You want to make sure that those people are coming in and out the door and they're flowing smoothly. The therapists are not running behind, that if somebody comes in a little bit late, that they're not disrupting the whole day's schedule too much. Your job is to keep everything flowing. So if you think about the rivers flowing, and if the flow stops, then they all dry up. Or if you think about our heart beating and the blood pumping and flowing through our bodies, if that blood stops pumping, then we die. So your job is to keep the patients coming in and out the door, greeting them, loving them, making sure you're collecting their co-pays if they're due, keeping everything running smoothly. All right, you got this. You can do this. Thank you. Aloha.